Alright ladies, this is Iveta, your pelvic floor corrective exercise specialist, personal trainer and yoga teacher. So planks, I got a request for planks and this is a quick and easy explanation for me, so why wait, okay? You're gonna need a wall space and you're gonna need a block for better and faster results, okay? I'm gonna explain why I do planks the way I do it. Planks are a pelvic floor exercise. You need to be doing them when you have diastasis recti. You need to be doing them when you have prolapse. But how and when is what matters the most, okay? So, and this info is, by the way, not just for women, it's for men. Hi, Zipper. Hi. So how to do planks. This is, anyone you go into the gym and you see doing them planks, oh my God, my heart's breaking, everyone's butchering planks. So this info is for men as well, okay? So before you do planks, you want to prime your body. You need to have some transverse abdominis strength, okay? So you should not be just starting planks out of nowhere. That's not the first exercise to do, okay? So if you're not able to tap into your TAs, as in right now, when I go completely relax my belly, I have zero abdominal control now. I'm going to, in standing, activate my TAs. It goes from my pubic bone. I'm exhaling and hardening. This is hard, okay? This is what needs to happen when you do a plank. This stabilizes my pelvis and my spine, the TAs, the transverse abdominis, okay? If you cannot do it, activate your TAs. Or you cannot do it sufficiently, I would have you stay on the floor, on hands and knees, or lying down on your back. That's the easiest way, okay? But just how so happens, planks, you do them every day, right? Kitchen counter, how do you go? Like kitchen counter, you lean a little bit forward, that's planks. You're changing sheets on your bed, you're leaning forward, planks, okay? So you kind of cannot really avoid planks. So I'm gonna teach you now how to do that properly. So this block, you're gonna squeeze between your knees. Always squeeze stuff between your knees. Adductors attached to the pelvic floor, okay? We need strong adductors because they help engage the pelvic floor and the TAs via all the fascial lines, okay? So you may find, and do this test, as you do squats, as you do planks, we do everything. My clients, they squeeze always something, a ball or a yoga block, roller, anything, always squeeze. Helps with the TA engagement. Obviously, if you are on the tighter side, no squeezing for you. Should you be doing planks? Maybe. Okay, depends on where your tightness is. I do have my clients with a hypertonic pelvic floor or more like a tightness have planks, but later on. I have to put some mobility into them. The other reason why we're doing internal the adductor squeezes is because when I engage my adductors, when I contract them, what it does that the legs stay put, but the adductors as they attach on the pubic bone, they spread the pelvis apart. So now the pelvic floor, the green tape, is a nice, perfect shape, is lengthened, and then can contract, okay? Because if you're squished here, the pelvic floor is in a position of a slack and cannot contract, okay? So squeezing isometrically meaning I don't move my legs, okay? So not exercises like this where you move your leg, just isometric hold, so squeezing something, okay? So you're gonna find a wall space, and based on your fitness level, you're going to be either completely perpendicular to the floor, which will be the easiest, or you're gonna find the level of difficulty appropriate to your body. We're gonna start at the bottom, okay? So heels will be, you'll be pressing actively the heels into the floor, okay? As you press the heels actively into the floor, engage your glutes, okay? The glutes will be engaged. quadriceps engaged. So your whole body should be like a string, okay? Everything engaged. As you squeeze your glutes, they should put your pelvis posteriorly. So like tucking your bum, you absolutely must have that, okay? You must have this posterior tilt, which is this, as opposed to anterior tilt. This is loading my back, okay? The other mistake that I see often is this rib thrusting, okay? So ribs coming out, and you will see that I see that on my clients, the arch. There's an arch in the back. Do you see this arch? Okay, so either I'm not stabilizing the pelvis, I'm in anterior pelvic tilt, the arch is a little bit lower. If I'm posterior tilted, doing this, and I'm thrusting my ribs, the arch is a little bit higher. Okay, so you go ribs in. If you are even able to do that. Some people are not even able to do that. There are exercises for that as well. But if you are thrusting your ribs, it helps press your arms into the wall. Press your arms into the wall. Push yourself away. Use your serratus anterior. That's this muscle here under the armpit that protracts your scapula. So the lower tip of your scapula should be kind of like under the shoulder, okay? As opposed to back here, all right? So you press actively into the wall so you have a nice straight spine, okay? So I'm not rounded and I'm not arched, all right? Now you imagine you have a string from the crown of your head going through your body, ending with the tailbone. When you need this tension to be able to do planks, okay? So someone's pulling you upward and from the top and from the bottom, okay? So this is how you do planks. Now, you're going to do a contraction of your TAs to support you in the plank on exhale, okay? So you're going to inhale into your rib cage. Watch my rib cage, okay? Inhale. Tucked chin, long neck, and I'm slowly exhaling, 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 exhaling. I hold it. I hold the exhale. Don't let your belly go. Don't let your belly go. Inhale. I forgot to squeeze my glutes. Now I squeeze my glutes. Okay, I'm squeezing the block. All right, and planks you will do for whatever, 30 seconds. You do a hold, okay? Breathe into it. I'm holding it and I'm doing a plank. Now keep watching my back. I'm gonna do it closer so you can see. Watch my back. Okay, inhale. See the back and side expansion. Exhale, contracting my TAs a little more. Inhale. See, I'm like almost like bumping away from the floor. Your back should be going here and here. Okay? You should see, or you should feel. Hold on, inhale. Exhale. Exhaling, and now I'm holding the brace. My entire backside expanding. Okay? That's how you know you're doing the plank correctly. Okay? So I'm gonna do a little bit more difficult version on this thing, because that one was really not demanding for me at all. So this is your kitchen counter. This is a tricep dip thing. Okay? Pretend it's your kitchen counter. So you'll be on your kitchen counter. You have 1 minute free of your time. So you're gonna sit yourself up, heels pressing into the floor, glutes engaged, TAs engaged, okay? And you're going to press with your arms into the counter. Inhale, squeezing the block. Exhaling, I'm squeezing the block. I can do a Kegel. I'm doing a Kegel. Feeling the lift inside my body, or my pelvic floor, and inhale. Exhale, contracting a little more. And see, so the common mistakes are butt away from the floor, right? So you have to kind of lean into it. Shoulders to your ears. Okay, so the shoulder to your ears will disconnect the upper body from the lower body, and you will be sagging. Okay, you will be sagging in your upper body mostly, right? So long neck, no forward headed posture like this. Okay, so tuck your chin. Okay, whether you should do a pelvic floor, a Kegel, a pelvic floor contraction, depends. Are you on the tighter side? Are your hips open or are they squished here? If this is how you stand all the time, this is wrong, okay? Your glutes should be loose. You should be able to open up. So there's video on that where I explain this. If you have hanging into your hips like this, okay? If this is how you do a squat, don't do a Kegel because you're have posterior glute tightness, okay? So it's gonna worsen your prolapse and all the pelvic floor symptoms. Don't do a Kegel then, okay? But if you are more like on the weaker side, you're strengthening, yes, squeeze the adductors, do the Kegel and exhale slowly, okay? So you feel the Kegel going, so you squeeze, pelvic floor contracts, feel the lift really like deep inside you, like it's lifting, the pelvic floor is lifting, okay? And only then you will feel your TAs automatically chime in, okay? And then you hold it and inhale, okay? So you should feel, so the other mistake that often happens is that, see this, when people do this, they see there's a midline, so there's a line here. So this is their middle abs contracting more. What does this do to my lower belly? Do you see this push? Pressure down. This is how prolapse is created, essentially. If it didn't happen due to pregnancy. It's this upper and middle abs overpowering because they're weaker, and you squeeze yourself here, okay? So also cues like belly button, navel to spine, nope. If I do belly button to spine, I'm cutting myself in the middle like the balloon. When you squeeze the balloon in the middle, what happens? Contents go up and down, pressure, prolapse, leaking, okay? So you have to really feel the TAs happening here, and sequence matters as well, okay? So maybe you will get heart here as well, but at last, okay? And I see it on video. When my clients send me videos or we are on Zoom, I see them exhaling this way. So the exhalation starts on the top first and then goes down. That's how I know they're bearing down or they're doing it wrong too, okay? So you should feel the exhale going like you're zipping up the pants with the adductor, with the pelvic floor contraction. Going here. And then ribs zip in. So some people are like this all the time. Some people have a wide rib cage. Some people have a narrow rib cage. So that would all impact a little bit how you do planks, and I'm not gonna go into that. But you should have like an equal nice abdominal contraction, and your spine should be flat. None of this, okay? Same with push-ups, because plank is the beginning of a push-up. When you see some people doing push-ups like this, yeah, they're arching, so they're loading their spine. You'll know you're doing it correct when your rib cage is expanding. So hold your rib cage. So you can do it like this first. Feel the thumb expanding like this. Feel it, see it. Hold on. Exhaling, 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 exhaling. And it should be also lower here, right? or here should be expanding. That's how you know you're doing it correctly. So sometimes it's good a side plank, it's the same thing. Okay, side plank, I'm doing a side plank right now. Hold on, let me show this. I'm doing a side plank right now. Pressing my heels, squeezing my glutes, okay? And I'm holding my rib cage. See if I get that thumb, if I get that pressure from my back into the thumb, okay? So for side planks, squeeze it, squeeze it always. You wanna be also one straight line, right? None of this, none of this, none of this, okay? This is how you would start. I'm pressing with my hand into the wall, pressing the heels down. Something's holding me up, something's pulling me up. This is my side plank. Now with side plank, you have to be really careful because what I see often is people go like this on a side plank and they hips kind of fall back. This is very evident as you go lower, okay? When I do this, my back takes over and I'm twisted. My shoulders are facing one way, my hips are facing other way. Wrong, okay? So you want to make sure that your shoulders and your hips are facing the same way. So for that, I like to be more like biased, sort of like towards the ground or towards the plank as opposed to side plank, like this for beginners, and not do a plank like this because most people will just like keep doing this. Like they're falling back, it's sinking, it's all your back taking the brunt of for supporting of your spine. It's not gonna be your core then. And the check if you're doing it correct is that ribcage expansion. Why? Why is that? Your breath will go or will take the path of least resistance, okay? So if I'm not stabilizing here enough, what will happen is your belly will do this. You'll be breathing into your belly, right? You'll be breathing into your belly as you do the plank. You should be able to hold it. No movement in your belly whatsoever. Otherwise, your belly, you're not holding the brace. And if you don't holding a brace, something needs to support the spine. What's the next thing that can support the spine when the abdomen is not doing its job? Even just for split seconds, because you could be doing this, like, oh, I'm supporting my spine now, I'm not, okay? So your back muscles will be going on and off. So you'll have a little wally like this in your back. You'll end up with a little back tension, and you're learning a bad habit that will be more difficult to relearn, okay? So if you cannot hold the brace, it's not like, oh, I cannot hold the brace, whatever. You're hurting your spines because something else needs to stabilize. And typically for planks, it's the back muscles that take the stabilization. So now, let's say this is boring for you, okay? You will go lower, and you will go lower, and you will go lower, right? Everyone that I know when I see it's like, let's do planks and let's do them on the floor. Why? No. Very few people can do planks properly on the floor. You can see them on the floor. Can they pass the test of them being able to breathe into their back when they are on the floor? Yoga teachers suffer from back pain and bulge disc because of all the chaturangas they do. And trust me, as a certified yoga teacher, I had no idea back then. I got certified in 2012. Please, I was doing them all wrong. I was just loading my back. So there's no need to go on the floor. So you go wall, because you can have the wall almost anywhere. You wait, I don't know, on a phone call. You do a side plank in your office. Waiting for the coffee to make. Cooking dinner. Side plank, plank on the counter. Like there, you don't need to carve out to to exercise. So that's what I teach my clients. Just make use of your time. This is functional movement. If you say you want to progress here, you cannot go lower because of whatever you're cooking. You want to, you can do so on one hand, right? Little taps. So like a three-legged plank. Hip abductions. Okay, and the hips, the leg is difficult, right? So it's gonna be very, this will strain you. What most people will do is that they will, did you see that? Arch. Okay? In order for me to move the leg, I need super hard core TAs. All right? So this is how you can progress. You can have a then band maybe around your legs, given you have no deep hip rotator tightness. Because if you do, and you're not able to use your glutes or glutes mat, it's just gonna be your piriform is taking over. You're gonna end up even worse. Okay? Balloon. Hold on. For balloon, you must know what you're doing. If you blow into a balloon correctly, you're gonna bulge out big time. Okay? But balloon is a perfect way for like extra layer because it forces you to. It's resisted breathing. Okay. But if you if it's your first time, I will have someone really check on you because like a new balloon, it's gonna be difficult to blow in. At least have it be a stretched out balloon. Okay. Okay, it's gonna give you extra resistance for your breath, but again, this is very advanced. So all right, and that's about it. Let me know if you have any questions. You know me, I'm super detailed. Someone needs to see you if you're doing the planks correctly, otherwise you'll be, at least in the beginning, then you learn yourself. Right, then you'll know. In any case, just open a camera on your phone, video yourself on just like, you use it as a mirror if you don't have a mirror, and see for that rib cage expansion, see how your belly looks like, see if you don't have the line, see if you're not like this, tuck chin, just, you can review your own form if you want to, okay? So, this was it. Thank you very much for listening. If you have any questions, let me know. I work entirely online. No need to travel. This is the stuff I do. You know me by now. Please reshare this video if you can. Do other women the favor. Not so much me, but also other women, to learn how to do planks properly. Because you see people doing planks on social media all the time, just like the leg lift that I posted, someone completely butchering leg lifts and hurting themselves, but she was skinny and muscles, and so people are like, yeah, I like it. But she was doing it completely correctly. You don't need to be skinny. Belly fat is good, protects your reproductive organs, right? Okay. But also look, I have belly fat, right? Look how my abs are after doing planks, because the transverse abdominis does this. It contracts like a corset. As opposed to when you rewind and see the beginning of the video, or if I completely let go, this is my relaxed abdomen. But you're not supposed to stand with a completely relaxed abdomen. You need a natural resting tone. You're not supposed to stand with completely contracted abs either. It's called resting tone. So the abs support your spine all the time. So they need to work a little bit, all the time. So finding that perfect balance between and over contract it. That's the trick. Now I over-contracted, I felt the pressure right down because I was talking, and as I contracted, I didn't expand my ribcage, okay? So just something to practice. Be aware of your body, and I'm gonna shut up now because I want to do my workouts now. All right, love you, ladies. Hashtag replay, hashtag live. If you can, ask me any questions, and please share this video for the love of God. Don't let other women make the same mistakes that we did, that I did. Ciao.